Thank you for joining us on Aesthetic TV. Today we're going to discuss solutions to a problem that 85% of women are currently dealing with.
You're absolutely right, Dr. Orden. It's a problem that most women try to hide with clothing or get rid of with useless creams and lotions. The problem is cellulite.
Now, Misha, aesthetic medicine has finally made some great inroads on dealing with this pesky problem that has plagued mostly women and a few men for as long as I can remember.
It's quite an exciting development. Cynosure has introduced two different ways to deal with cellulite. One is a non-invasive procedure called SmoothShapes, and the other is a minimally invasive procedure called Cellulaze, a breakthrough technology that was just recently introduced.
And joining us to talk about these two groundbreaking and innovative procedures is Dr. Miles Graivier, a board-certified plastic and reconstructive surgeon from Atlanta. Dr. Graivier, thank you so much for joining us here today.
Thank you, Dr. Orden and Misha. It's a pleasure to be here today, and maybe we can educate your viewers as to what we can do to get rid of this stubborn problem that's called cellulite.
Before we learn how to get rid of it, could you give us a little background on cellulite? What exactly is it? What causes it?
Oh, absolutely. Cellulite is a problem that occurs just beneath the surface of the skin. That's what makes it different from that excess adipose tissue. It actually occurs because there are these little fibrous bands that we call septae, and in between these are little areas of fat that kind of bulge up. And these septae are pulling the skin down and give it that little dimpled appearance, and then you have the bulging around it. And also the skin gets very thin, hence the appearance of this cellulite.
You know, Misha, I like to call it fat that's gone wild.
I don't like
that fat, instead of sitting where it belongs, as Dr. Graivier told you, sort of bunches out and causes that dimpling and bunching that nobody likes. But, you know, it's really important to note that cellulite is not caused by poor diet, lack of exercise, or increased body fat. You can be thin and still have cellulite. What does cause it is hormones, vascular changes, and inflammation.
Well, that's really interesting. I think most women feel that they've caused cellulite themselves by not taking care of their body, but it really isn't our fault.
Oh, absolutely not. Even supermodels with personal trainers and little bitty women that work out all the time can have cellulite just as much as a few people that have a little extra weight. Now, the other issue that's really not fair is that men don't seem to get very much cellulite. And that's really because their hypodermis, or the area just beneath the skin, kind of looks like a honeycomb. It's more of a diamond shape as opposed to these rectangular shapes of bulging.
Exactly. And lucky for all of our viewers out there, we have another way to help slow down the aging process. This time, it's cellulite solutions from Cynosure.
Dr. Graivier, why don't you tell us more about the two new procedures our viewers could use to deal with cellulite?
Well, Cynosure has made available two very different procedures that work well together or separately for patients to kind of get their desired look. So let's start with the non-invasive procedure, which is called SmoothShapes.
I love that name. Tell us, how does it work?
Well, SmoothShapes is kind of the best-in-class, most clinically proven non-invasive treatment for cellulite. It uses a proprietary technology called photomology. It uses some suction rollers and some combination of light-emitting diodes and laser energy. Number one, to punch a little hole in the fat cell just beneath the surface, and it liquefies the fat, and then those suction rollers will actually get the lymphatics to pick it up and smooth the skin.
Doesn't that sound pretty cool, Misha?
It does, but I need a little more.
We all want to know, are there certain parts of the body that are particularly well suited for this type of procedure?
Well, there are, and because the area of cellulite is usually in the buttocks and the outer thighs, but it also can work nicely on the hips, the abdomen, sometimes even the arms and some areas like the knees, but it really works very nicely in these areas.
Wow, so you really can cover the whole body with this, and it looks like it's a quick procedure too.
It is, and it's what we kind of call the lunchtime procedure, because you can come in, it only takes about 20 minutes, and it actually really feels good. And that massage, and I get it sometimes just to relax, even though confidentially I don't have any cellulite.
So I guess what you're saying, Dr. Graivier, so you can literally pop into your doctor's office during your lunch break and return to work a whole new person.
I love the sound of that. It couldn't be easier to get rid of cellulite. Now, who are the best candidates for this type of procedure?
Well, it's of course people that are interested in the procedure, but it really, really works well in women that are in their 20s to 30s with some early kind of grade 1 and early grade 2 cellulites. And it's really important I think that it works well as a standalone procedure, but you can also add it on to some more invasive procedures such as smart laser lipo, which is laser-assisted liposuction from Cynosure as well.
And I'm sure everybody out there wants to know, I want to know, how many procedures typically do you need to go through to get the kind of results you're looking for?
You know, we usually like patients to have a series of 8 treatments of SmoothShapes, and we usually do 2 a week. So it's kind of nice to pop in about lunchtime and have those 2 procedures, get relaxed, and also have your cellulite start to disappear.
Now, we know that people are always a little skeptical about new procedures when they come on the market, and that's particularly true when it comes to cellulite. You know, people have tried creams, lotions, and were not getting the kind of results they were looking for in getting rid of their cellulite. So tell us about the kind of results you've seen using SmoothShapes.
Well, you're absolutely right, Dr. Orden. It's good to be skeptical, and you really have to look at these procedures and look at the clinical studies that have been done. And Cynosure has done a lot of clinical studies regarding SmoothShapes, and we found that 94% of patients that have had SmoothShapes 6 months later felt that they had a nice result after these treatments.
That's a pretty impressive number. Well, let's take a look at some before and after pictures of patients who've had SmoothShapes to really see their transformation.
Sounds good.
Oh my, that is amazing.
Yeah, and what you really see is this very nice result. And this patient has some grade 1 and grade 2 cellulite, which is a little bit of the mattressy pattern if you kind of look there. Just obviously a little younger patient, but you can see just a great result. And that result really, we found, seems to last for at least 6 months to a year, and sometimes we'll have patients come back for a little touch-up, and sometimes they want to come back, in fact, more often than every 6 months to a year.
Okay, so I would like to ask you, though, because I know for viewers out there, and myself included, when I see those pictures, I always think, oh, you've done something with the lighting. You have not. That's the actual result.
That's the result, and you can see that standardized photography is very important in plastic surgery. So you can see the same magnifications, the same camera being used, and really the exact picture. And you see a really nice correction in these. And again, this pattern on the patient on the left side in the before portion has what I would call a combination of grade 2 and grade 3. So if you look, you see a little bit of that mattressy pattern, but you also see areas of some deeper dimpling, that grade 3 that's a little bit harder to correct.
I mean, huge improvement. But I think your point is very important, that for some people you do have to be prepared for maintenance treatments down the line to keep that result up.
Yeah, the other interesting thing I think about the SmoothShapes technology is that in just about every patient that I do body contouring with, I'll do a SmoothShapes treatment immediately before the surgery. And then I do a treatment 1 week, 2 weeks, and 3 weeks afterwards. So it really is a nice method, number one, to decrease their swelling and bruising, and also take care of a little bit more of that surface area, which you sometimes see the dimpling.
And it actually feels good.
It does feel good. It just feels like a warm kind of suction massage. And you don't wear any special garments or anything. It's very relaxing, very, very tolerable, and it just kind of feels very gentle. It's really nice. I get it occasionally.
The results are definitely astounding. Wow.
Good stuff.
Yeah. So, Dr. Graivier, you said that SmoothShapes is a great procedure for those who are interested in non-invasive treatments for cellulite. But what about those who are looking for something more immediate and longer lasting?
Well, the next level of treatment would be a minimally invasive procedure from Cynosure called Cellulaze. It's the world's first and only procedure that's actually for longer lasting correction of cellulite after only a single treatment.
So what would be the cost of this type of procedure?
Well, the cost varies, but it really starts about $5,000 depending on the areas that are done. It can range up to $10,000 or more if we're really treating a lot of areas.
So that sounds similar prices to liposuction.
Very much so, very much so.
Very, very close to that. Well, Cellulaze certainly sounds like a breakthrough technology in aesthetic medicine, but explain to us what makes Cellulaze so different than everything else available today, especially liposuction, and how does the treatment get rid of the cellulite in just one visit?
Well, unlike some of these other non-invasive options or creams or lotions, Cellulaze actually attacks the structural elements directly beneath the skin. But it is a little bit different than liposuction, where liposuction we're really addressing the deeper areas of fat bulging, especially in the outer thighs, the saddlebags. But this is really just addressing the cellulite. And again, that's the area just beneath the skin. So we can really treat that effectively by addressing first the little bulges, where we turn the laser fiber down and put heat on them. And then we turn it sideways and release these little fibrous bands that are causing the dimples. And then we turn it up. And so the laser fiber is shooting forward and up towards the skin, so it really thickens the skin. So I think the result is we're really changing the architecture of the hypodermis, or the area where cellulite occurs. And that's why we're getting the long-lasting effect.
You said earlier that this procedure is minimally invasive. What does that mean, and how is the procedure actually performed?
Well, what it means is that most of the time we perform the procedure under local anesthesia with some oral sedation. So we make people comfortable, giving a little pain medicine, a little bit of Valium, and then we inject just beneath the surface of the skin this tumescent solution, which will numb up the tissue. Well, then we make a very, very small incision. And if you look, this is the actual laser fiber with the outer thermoguide. And if you look at it, it's very, very thin. So we just have to get this through the skin. And once we place this through the skin, we actually will treat the bumps first, where we turn this down so it's firing out and down. And that brings the bump that you see in cellulite down. And then we turn it to the side, and we use it to kind of release these bands. And then we turn it up just beneath the surface of the skin. We actually turn out the lights, and you see this little illumination that's being shown right through the surface of the skin. And as I said, this thermoguide right here will keep it from going higher than 47 degrees centigrade. So it's very, very safe, so we don't get any burns or anything such as that.
Dr. Graivier, I think you brought an animation that shows us exactly what's going on with your cannula underneath the skin.
I do. So here it's face down, and it's shooting the energy down to bring the lump down. And then these are these little fibrous bands that you see. It's releasing them, and also puts some energy and heat into these areas. And then we turn it up just beneath the surface of the skin. See how close that is? And it heats the tissue and thickens the skin. So it's really a three-step procedure, and this is kind of what the area looks like just beneath the skin after it all heals down. So you see the architecture has actually changed, and that's why I think we're having a long-lasting effect.
That's incredible. You can actually see when you snip those bands that the bump
dimples
goes away.
go away.
That's amazing.
And the treatment on the fat smooths out those irregularities of fat deposits.
It does. It does very, very nicely. Been very excited. And again, it's a single treatment. These little puncture sites, a few of them we even leave open to allow a little bit of drainage. But most of the time, if we do close up any of those, it takes one stitch, which comes out about 3 or 4 days later.
And so overall, is it painful?
You know, it's really not. People tolerate this really, really well. We have a specific amount of energy that we put into each of these little 5-centimeter squares, but it's very easily tolerable. They do get a little bit of swelling and bruising afterwards, because right below the surface of the skin there are a lot of capillaries. But I think it's much less uncomfortable than liposuction itself. And you're really back to normal activity in about 2 or 3 days at the most.
Michelle, everybody's concerned about the pain issue, but you know, obviously the area that is being worked on here is numbed with a local anesthetic, so there really would be very minimal discomfort during this procedure. And I'm guessing that patients probably really have very little soreness and are down for only a day or two after the procedure. Isn't that right?
Oh, that's absolutely correct, Dr. Worden. Like I said, you know, for a person not to have to undergo general anesthesia, they really feel a lot better. And when they're back to the normal activities, even though they are wearing a little compression garment, they're really happy, so it's very easy to recover from.
So a major benefit to Cellulaze is that it lasts longer than other procedures, and you only have to have one treatment to get the results. That's amazing. I bet patients love it.
They absolutely do love it. In fact, Cellulaze has a patient satisfaction rate of 93%, which, if I remember correctly, would give you an A in school. In fact, patients now are 2 and 3 years out from the original 6-center study, and those results are still holding. So we can actually say that it's a long-lasting result and probably continuing with those patients. But right now, again, it looks like it's lasting 2 to 3 years, and hopefully will continue to last.
And you're talking about just after a single treatment, correct?
That's correct.
This has been unheard of until now, and I certainly can understand why your patients are so satisfied. Why don't we take a look at some before and after pictures of patients who've been treated with Cellulaze.
Well, there you see, if you look here, this is actually even a little bit deeper cellulite. I would even call some of the deeper areas grade 3, with some grade 2 as well, meaning a little more mattressy. The grade 3s are obviously harder, but in those grade 3 areas with the deeper depressions is where we really turn the laser fiber sideways and try and release those bands, but also put energy into them. And I think that's a really important point that distinguishes this treatment from any other release type treatment for cellulite. So you can see, in fact, this really deep depression, that's definitely a grade 3. And you can see the results as it really smooths the outer thigh there. And again, it's done under local anesthesia with a little teeny puncture site. So they really recover very, very fast.
And one procedure.
One procedure. You know, the nice part is, too, is if someone such as this comes in who's obviously had a great result, and they're very happy with it, we can still take our SmoothShapes treatment and say, you know what, we can even make it a little teeny bit better. So we take that 93% and we can make them 100%.
I love it. How soon after the procedure can a patient expect to see results?
Well, I tell the patient that some of them will have a little bit of improvement that they see anywhere from 3 to 6 weeks afterwards, but really you have to wait at least 3 to 6 months. And sometimes in that period, sometimes you're going to see great results at 3 months, but you're absolutely going to see great results after 6 months. And as I said, with a 93% success rate or happiness, we can change it even 100% by adding a little SmoothShapes if necessary.
Patients should still remember to maintain a healthy diet and exercise routine to continue enjoying their excellent results. Treat your body right, it will return the favor.
This has been a very interesting discussion, and I'm so happy cellulite has finally met its match with SmoothShapes and Cellulaze.
Dr. Graivier, thank you so much for joining us here today to tell our viewers about these fantastic new procedures.
You're welcome. I've really enjoyed being here. Thank you for having me.
If you would like to find where you can have Cellulaze or SmoothShapes performed in your area, make sure to use the Aesthetic TV Physician Finder or visit Cellulaze.com or Cynosure.com for more information. Thank you for watching Aesthetic TV. Stay tuned and stay beautiful.
See you next time.